great. Hello, welcome. I'm Dr. Whispers. I was waiting for you. Can you give me your name, please? Let's take a peek to your medical history here. So this is your third time here with us. You have been receiving some treatment for your lips before. Let me see if we have some pictures of your other procedures. Okay. You got an enlargement a few months ago. Last year, actually. And also reshaping last year too, with a slight enlargement. Okay. So today you're here for another reshaping. What do you want to change about your lips? I see that they have returned to its normal shape. That is pretty normal. It doesn't last that long when you don't do the permanent treatment. So in your case, it lasts around 3 to 4 months, depending on how good you take care of your lips. Yeah. Okay, let's see. We have used injections on the last session, but no permanent shaping. Okay, the enlargement, we can do it, but as it says here that you have booked your appointment for a permanent reshaping, it's very different from what you're used to and what we have been doing here before, if you remember. We have to change the type of lips that you have right now and specific how they look. It says here that you want to change the upper one, just one, that one in the shaping. So right now the shapes that we are currently doing will be the Cupid's heart, which is this one right here, as in the number 1. Not all people have it. Some people have very flat lips on the area, so we try to recreate the Cupid heart, I'm sorry, in this part. We can do it very, very sharp or in a curved way, which will be number 2. We also have the number 3 that is also a little bit sharp, but with a curvature at the center right here, which is pretty different from this one, the first one, which is more pointy. This reshaping takes around 10 minutes or so to do it. It involves applying local anesthesia in the area, along with injections and a little bit of sutures. It will be internal. There will be nothing showing on the outside, but there could be some bruising for, well, it depends on the person, but more or less a week or 2 maximum. So just so you're aware that during those 2 weeks there might be bruising on this area right here, and it's not gonna look kind of pretty. Can be covered with makeup, but the top part needs to be covered with gauze for around, let's say, 3 days. After that you can apply makeup, and it's gonna look swollen for a week, but after that just covered your bruises. I wanted to tell you this beforehand if you want to go along with it, or you want to do a normal reshaping that takes and lasts for 3 months or so, the ones that we have been doing before. You want to go with the permanent one? Yeah, of course, no problem. So we're gonna start first by analyzing your current lips and see what are the special needs that it's requiring this time. So you want to go with number 2, you're telling me? Oh, number 3, I'm sorry. Okay. So now we have to see if your lips are candidate for it, for the permanent one. It's pretty easy to do it with injections, but for it to last a lifeline, it takes a little bit of difference. Okay. Okay, there is a lot of dryness in your lips. Quite a lot. We're gonna have to do an exfoliation before we can go with the procedure of enlargement and reshaping. Let's see. So we can definitely work with the Cupid's heart here. We just have to raise your lip on this side, which will be this one and this one. We are gonna be pulling it up for a bit. So as you see here in our chart, we're gonna go with number 3. So in this area in particular, we're gonna pull it up for a bit, and we're gonna put a stitch on top of it so it stays there. Okay, we wanted to move it up right here, so it's gonna get stuck into the upper lip just a little bit, so we can create it like that. And then we're gonna dent it just a lower bit here. I think it's gonna require a surgery here too. We're gonna go and see along the way. No. Yeah, there's a lot of dryness in your lips. Have you got a cold recently? Maybe dehydration. Sometimes happen when you don't drink a lot of water, or we are in the sun exposure for long periods of times, and that can affect our lips. So as I see here, you're a good candidate for it. We can work with what you have. You're gonna have to pull up just a tiny bit. Let me get my ruler here. Just want to see how much we need to pull up in your case. So 1, 2, 3 should be enough in this case. We want to make it the same on the other side. 1, 2, 3. Yeah, it's possible you have enough skin and lip there. We can pull. If the lip is too skinny, too close together to the bottom, it won't be possible. We have to do the enlargement first, permanent enlargement, and then pull up the lip. But in your case, you have enough that we can work with and do the reshaping, and that will be good. There's a lot of flaking here that might affect the result, so we're gonna do a very nice exfoliation and soothing of your lips. It's gonna feel great. So yeah, we're gonna go with stitches number 3 in your case. number 3 along with 4. Okay, so definitely it's possible. You're a great candidate for it. Gonna take around 10 minutes or so, and the healing time, as I was saying, depending on how you personally heal, up to 2 weeks. So I want you to be aware of the bruising because it's gonna happen. Okay, now I need you to sign something here that you're aware that this is gonna happen and that it's not gonna look exactly as you want the first day. After the second week is when you're gonna notice perfect lips as you wanted it. Okay, now let me get that print out. So okay, there we go. Now I need you to sign here. You can read it first. It's just say that you're aware that there's gonna be bruising and that it's gonna take around 2 weeks for it to heal completely. Okay, well, I just need your signature here. Excellent. So we're ready to begin now. Let's start with your lip exfoliation. A lot of flaking here. So let's start by soothing your lip. We're going to be using this cream lip balm of aloe vera, which is amazing for this type of problems. That is amazing for this type of problems. Okay. It's gonna feel kind of minty. Okay. Don't worry if you taste it, it's completely natural. But in the next one, I don't want you to taste it, okay? So be aware of your tongue. Try to place it all the way to the back if it's possible. We're gonna leave this here for a couple of minutes while I prepare you for the procedure. Okay. Let's cover your hair. Let me know if you're comfortable like that. Good. Okay, well that works. I'm gonna clean the part of the middle face. You're not wearing any makeup base, foundation, anything? Good. Now can you do this? Good. Keep doing that while I clean and disinfect your face so we can continue with the procedure. Tastes very nice. The aloe vera, it's very good. There we go. Now let's see. Let's put a bit more. During the exfoliation process can be a little bit of discomfort, but it's necessary to clean your lips of all this dryness and or the flaking that you have. Okay. Now, this next solution, try not to taste it because it's better. Okay. I'm gonna get rid of all the flaking that you have. You can actually do this at home with a toothbrush with soft bristles. You can even use paste, dental paste on your lips. It's completely safe, but do it gently whenever you feel like your lips are flaky. But the most important thing is to hydrate them and drink enough water. That's the number one way to have very beautiful lips. Okay, that looks much better. Good. Now pout a little bit, like this. How does it feel? Softer, isn't it? Yeah, but there's still some cracking here. I wanna be very gentle with it. We don't wanna get any injury to the lips, because if we do it, we won't be able to do the procedure at all. Okay, that's enough. Okay. We're gonna apply it. This one is also very bitter. Don't taste it at all. There we go. Looking much better. Regaining its natural color. The blood flow is coming back. Normally when we have very dry lips, they look pale. Blood is not circulating well enough to make them look blonde and pinkish in some cases, or darkish depending on the skin tone. There we go. Now the last brushing. For this, I'm going to use a dental brush, completely new. Okay. Yeah, you can use something like this, but don't use the same that you used for your teeth. Use a new one, a different one, just for your lips, okay? This one is new. This is the type of brush that I use for my clients to do the exfoliation of the the lips, okay? Very, very gently. You don't want to put too much pressure into the lips and cause damage and cuts. Nice and easy. Very good. That looks great. Excellent. Now, just gonna put a little bit more of aloe vera lip balm and moving down with the lip drawing. I'm gonna draw the shape that your upper lip is gonna have at the end. I want you to let me know if you like it like that. I'm gonna take into consideration the measurements that I took earlier. Okay. Let's dry the area right here at the top. Okay, done, please. So we're going up a little bit here. The Cupid's heart going down in a curvature in the area here. And then up again and going down, merging with your natural lip like that. Okay, now to your side you have a mirror. I want you to look at the shape. Let me know if it's the kind of shape that you want. I can do it a little bit sharper and a little bit more curved in the middle. Whichever shape that you want. That one's exactly as the number 3 as you wanted before that I have here. You can see that it ends in a little curve at the middle. A little bit more pointy in the top. Yeah, definitely can be done. Okay, so gonna make it a little bit sharper at the top right here. In that case, it should stay like that. Just a bit up so it gets like that. Okay, there we go. And take a peek again. You like it like that? Okay, yeah, it definitely is gonna look natural. Pretty plump. I'm gonna have to add just a bit here. On the bottom, you just want the normal enlargement that you always have. Okay. So we're gonna go along with this shape as you want it. I'm gonna prepare you with the local anesthesia. You're gonna feel your lips like they have no weight. You're not gonna be able to talk properly. In any case you want something, you want me to stop, it's better to touch my hand, okay? Now it's very important not to sneeze or cough during it, because I will be moving along your lips with sharp tools, so just be aware of that. If you feel that you need to cough or sneeze, try to warm it beforehand. Okay, very good. That's a very nice shape, and it's gonna work great. Let's start with the local anesthesia. We're gonna first apply it at the whole area of the face here. It's gonna feel very weird sensation, and after that I'm gonna apply the injection on the top. Okay, good. It's gonna feel completely numb and warm too. The warm sensation is gonna start first, then the numbness. You're feeling it? Let's wait a little bit so we can continue. I'm also gonna remove some of the fuzzy hairs that you have in the top lip. Okay, for that I'm gonna be using this little blade. How are you feeling? You got the numbness now? Good. Can you feel me blading the area? Shaving it? Not quite. Good. Let's see. I'm gonna touch it. Let me know if you can feel anything. How about this? And here, 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 here. Good. Now I'm gonna apply local anesthesia on the top lip, where I'm gonna put the little stitches. And here we go. Good. Now another one. There we go. Now give it a little massage. It's gonna feel weird. Yeah, weird sensation. Okay, can feel me touching your lip? Doing this? Do you feel that you have your mouth open or closed? Well, you have it open. Yeah, that's one of the things. Now I'm gonna need you to recline your head to the back. Now I'm gonna put a little braces on the side, just so you don't move your head too much during the procedure, because right now you cannot control your lips that much. So just to have you in one position. Good. Now, the needle that I'm gonna be using during the enlargement on your lips is gonna be this one. Pretty small, as you can see. The needle is very small, so you remember. Which is gonna be the same for the stitches that I'm gonna apply there. It's this one. Okay. Very good. You ready? we're going to start in the upper lip so we can create the Cupid's heart shape that you want in there. I'm going to be applying pressure on the area so I can put the stitch where I want it and place it in perfect position. Just like that. Okay, try not to move. Good. You're doing great. There's a little bit of blood, but don't worry, it's normal. Stay like that. Doing a great job. Excellent. Your lips are going to look a little bit swollen at the end, more plump than what it's intended. Remember that after a week it's going to go down to normal size, or even a couple of days later. It depends on the person. That looks great. You have put the stitch right where it belongs, pulling your lip up into Cupid's heart shape. I'm gonna show you right now. It's a little bit swollen. There is no blood present at all. Just a little bit of redness, very normal, but I want you to look at the shaping. You can take the mirror right here. Yeah, it looks amazing, isn't it? Just with a little stitch, it's gonna stay there until maybe you want it to go down in the future. It can be done. It's completely reversible. So you like it like that? Because right now is the time. Yeah? Okay, perfect. So we're gonna move down into the enlargement. Lip injections there. Now go back to your position. Like so. Good. And let's go with what we are going to inject into your lips to make them look plump. We're going to be using 30 units on you. That should be enough. Okay. Now we're are you feeling? Any pain, discomfort? No? Good. That's what I want to hear. No discomfort at all. Looks nice. Use the next 30 units. Good. 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 Excellent. Looking very nice and plumped. They're gonna look perfect for around half an hour, and after that the redness and the bruising is gonna start to appear. You know, a week or 2 weeks later, perfect lips again. Okay, we're done to our last 5 units. How is the discomfort going? Anything? Not at all? Good. And we are done. Dispose of that. Okay, take a look again. You have the mirror here. Now I'm gonna work on soothing your lips after all the little injections and the shirt that I put. I want your lips to have a little bit of pampering. You like the result? Well, now after the soothing, they're gonna look great. At least for half an hour. Half hour to an hour, and after that, everything that I was telling you about is gonna start happening. Okay. Apply this directly to your lips. Give them a little pampering after all the poking that we just did. I want them to feel good and happy for what they have endured. There we go. There we go. We're gonna end with a little massage with the aloe vera balm. It's a great aroma, I love it. I'm gonna give you a sample of the aloe vera balm so you can use it at home to soothe your lips during the recovery. You're just gonna apply it with your clean finger like this as I'm doing it, and a gentle massage. Okay. Very good. Now what I want you is to regain the sensation on the area. So that will take around 5 minutes more. Can you feel anything that I'm touching right now? Barely? Okay, it's losing its effect now. It will go back to normal in no time. So let me update your information here while you rest a little bit. Keep your head like that. So we put 65 units on 3 on each lip for the enlargement, for points of suture that I want to take a look again in 2 weeks. You have another appointment to see how well it's been healing, okay? But if at any moment you feel something not going good, come to us immediately. You don't need an appointment. You just want to have to wait a little bit in the reception if I'm taking another patient. But after that, I'm gonna pass you, okay? No need to put an appointment. Just give your name to the receptionist. So we did also aloe vera treatment for exfoliation too. And we also did, okay. Now during this time it's very important to keep your lips hydrated. So keep using the aloe vera daily, okay, with gentle massage. I'm gonna give you a prescription for the pain. You might feel a little bit of stinging sensation after the anesthesia wears off. I'm gonna give you one right now so you feel it. Here, it melts in the mouth. Just one. I'm gonna give you for a week. You shouldn't be feeling any pain after the second day, but I'm gonna give you for a week, okay? In any case, if you have it or not. Some people don't have any pain at all after this, but again, it depends on the person. Okay, you're gonna take this every 6 hours or whenever you feel discomfort in your lip, okay? If you start feeling like this sting, you take a pill. Okay, now you have your appointment for 2 weeks. Do you want it in the morning or afternoon? Okay. Afternoon is gonna be good. So you're all set with your appointment for 2 weeks time in the afternoon, and your prescription is gonna be ready in the reception. I'm gonna give you the sample of lip balm with aloe vera, which will be exactly as this one. You're gonna be applying daily, okay, whenever you feel your lips are a little bit dry. Okay, let's see how they are developing. If you can feel something, I'm gonna touch you with this. Can you feel that? And this. Okay, can you feel me putting pressure here? How about here? in this area. Here. Are you feeling any discomfort at the moment? Pain or a burning sensation in your lip? No? Okay. Let me end putting a little bit of sun protection on the lips. Don't worry, you're not gonna need it. I'm just applying it right now because you had the stitches put on there, just for an extra protection. But you don't really need it. It's just something I like to do. Let me take this off. Okay. Now, one important thing is try not to open your mouth too wide, at least for a few days. Laughing. It's kind of hard not to smile or laugh. So just be aware of your lips, because when you laugh and you smile, you're gonna pull them up to the sides. So that can be uncomfortable for sometimes, especially with the surgery that I put on. Just be aware of it, that it can happen. But with the medication that I gave you, you shouldn't be feeling any pain. It's gonna feel a discomfort, like you're pulling a little bit. So just be aware of it, that it can happen. Do you have any further questions? Makeup, as I was saying, in the first week, let's say 3 days time, you're gonna start seeing the bruising completely there. That's when you start putting makeup if you want. Don't put any makeup from today till 3 days, 2 days. We don't want anything there, not even cream or anything, just what I gave you. That's the only thing that you can put in the area. And after that, you can put makeup as you wish, or lipstick, whatever. And any other questions? Well, it was a complete pleasure working with you. Your lips look amazing, very, very beautiful. If you have any questions in the future, or are having a rough time, you can call us or come directly with us in our working hours. Now, here in the reception, they're going to give you your prescription and your lip balm. Okay? Take care. Goodbye. Karen, yeah, you can send the next patient, please. Thank you. Let's disinfect our hands. Hello, welcome. Please take a seat. I will be with you in a minute. Can you give me your name?